There's just a few days left to apply for insurance under Covered California. Right now, they're reporting a record number of people have enrolled in this program. Joining us this morning live via Zoom is Executive Director Peter Lee. First of all, Peter, thanks for joining us.
Great to be with you, Mike. Good morning.
First of all, are you surprised at this number so far? I mean, given the pandemic, many people losing their jobs or being out of work, did this surprise you?
It doesn't surprise me really, but it's still really good news because it really means that we're doing what we're supposed to do. In a bad economy or a bad health situation, Cover California is there to get people to sign up, and we're actually thrilled. We're getting not far off from 2 million people getting really good, affordable coverage.
Now, the deadline being the 31st, so that is Monday, correct?
That's right. People need to enroll by midnight on Monday, which means do it today or tomorrow. Don't put it off. And people might be confused because we've been open a lot over the last year and a half. During the pandemic, we said we'll be pretty much open all the time. When our door closes on midnight on the 31st, people that don't sign up, if they don't have a change of their life circumstance, may not be able to get insurance for another year. You don't want to go through 22 without insurance when you can get it really affordably right now.
Now, despite these record numbers, I'm just kind of curious, what is the biggest misconception that you've heard since Covered California began?
Yeah. Well, the number one both misconception, but actually not wrong early on, was people said, even with this financial help, I can't afford it. It's just too much for me. I've got to make a choice between that used car payment and insurance. But the American Rescue Plan, the federal law, kicked in this last year, and it's in place all this year, and it's lowered costs. So hundreds of thousands of people that have checked have said, wow, 2/3 of our people signing up can get health insurance coverage for less than $10 a month. And for others, middle income folks, they're now eligible in ways they were never eligible before. So it's that issue about affordability. People want insurance. They just don't think they can get it.
What's one of the areas within Covered California that gets utilized the most?
Well, really, two things I'd note is that first, preventive services. Getting coverage means you have a regular doctor, you see them, you stay well, you get healthy. That's the number one. The second that people don't talk about much, it's mental health. Boy, we've seen with the pandemic, mental health issues, anxiety, substance abuse. Covered California's coverage addresses all of those. The final thing, Mike, for a few people don't want those awful things to happen. But look, if you do show up in the hospital and you end up needing expensive care, people appreciate they don't walk out owing a mortgage. And I just got to give you that example of, look, you go in and you get COVID, God forbid, get vaccinated, wear that mask. But if you end up getting COVID and going to the ICU, you walk out with a $127,000 bill. You don't have insurance, that's a medical debt looming over you for years to come. You have Covered California, you pay a couple thousand or less. So having insurance really is about peace of mind.
Deadline on Monday. How many people do you think is going to enroll over the weekend?
I don't know. Tens of thousands. And the trick is you go to coveredca.com. If you're a little bit confused, put in your zip code. Throughout the Central Valley, we have thousands of insurance agents that'll help you get across the line. Their services are always free.
All right, very good. Peter Lee, Executive Director with Covered California. Best of luck to you as we bear down on this deadline.
Thank you so much. Have a great day. Be well, be safe.